Welcome to the special DSC webinar on the disability class, brought to you by HUB. Join us on the 25th of May 2026 for an insightful session. Find us on YouTube at HelpHub007. We begin with questions on intellectual disability. Question 1. A boy of 8 years is poor in math but performs daily tasks independently. Which of the following weakens the diagnosis of ID? The correct answer is C. Proper adaptive functioning. Question 2. Which of the following conditions falls under the developmental period? The answer is B. Onset of intellectual disability at 14 years. Question 3. A student has an IQ of 68 but lives socially independently. What is the correct analysis? The answer is B. ID cannot be determined by IQ alone. Question 4. Which of the following is not a core feature of ID? The answer is C. Mandatory motor paralysis. Question 5. Which example demonstrates a weakness in the practical domain? The answer is C. Inability to dress oneself. Question 6. A boy understands concepts but does not follow social rules. Which domain is most affected? The answer is B. Social. Question 7. What is the correct description of ID? The answer is B. A lifelong neurodevelopmental condition. Question 8. What are the two most critical factors in diagnosing ID? The answer is B. IQ and adaptive behavior. Question 9. Which is not part of adaptive behavior? The answer is D. Blood pressure control. Question 10. Which of the following scenarios is most appropriate for mild ID? The answer is B. Being able to work with some support. Question 11. Why is diagnosing ID solely based on IQ not appropriate? The answer is C. It does not fully reflect real-life functioning. Question 12. What does the term neurodevelopmental disorder indicate? The answer is B. A. Deficiency starting in the developmental state. Question 13. Which of the following is an example of a social domain deficit? The answer is C. Inability to understand others' feelings. Question 14. Can a person with ID lead a meaningful life? The answer is C. Possible with proper support. Question 15. Which of the following is a conceptual skill? The answer is C. Reading and math reasoning. Question 16. What is the classification of a person with an IQ of 52? The answer is B. Moderate. Question 17. What is the correct decision if adaptive functioning is very low and IQ is 72? The answer is B. Mild ID may be present. Question 18. What is generally observed in profound ID? The answer is B. Extensive lifelong support is needed. Question 19. What is the main focus in AAIDD classification? The answer is B. Support needs. Question 20. What ability can a child with moderate ID generally show? The answer is C. Supervised vocational tasks. Question 21. What category does a person with an IQ of 18 belong to? The answer is D. Profound. Question 22. In classification, besides IQ, what is most important? The answer is B. Adaptive functioning. Question 23. What is generally present in severe ID? The answer is B. Limited communication skills. Question 24. To what extent can a person with mild ID generally read? The answer is B. Functional academics can be learned. Question 25. What is the main goal of AAIDD? The answer is B. Support planning. Question 26. Which of the following indicates severe ID? The answer is C. Continuous supervision needed. Question 27. What is the most beneficial intervention for a person with moderate ID? The answer is B. Functional skill training. Question 28. Why is support intensity important in classification? The answer is B. To know the required level of support. We continue with intellectual disability. Question 29. What is generally possible for those with mild ID? The answer is A. Guided independent living. Question 30. What is the main symptom of profound ID? The answer is B. Extensive assistance in all activities of daily living, or ADLs. Question 31. Severe alcohol exposure during pregnancy primarily falls under which category of ID causes? The answer is A. Prenatal. Question 32. Birth asphyxia is a cause of ID in which category? The answer is B. Perinatal. Question 33. Fragile X syndrome is which type of cause? The answer is C. Genetic. Question 34. A child experiencing cognitive decline after a brain infection falls into which causal category? The answer is C, postnatal. Question 35. What risk increases due to severe malnutrition during the mother's pregnancy? The answer is A, prenatal neurodevelopmental damage. Question 36. Prematurity is mostly related to which category? The answer is A, perinatal. Question 37. Which of the following is a preventable cause? The answer is B, birth hypoxia due to poor delivery care. Question 38. Down syndrome is primarily caused by which change? The answer is B, chromosomal abnormality. Question 39. The impact of infection exposure during pregnancy is mainly in which stage? The answer is A, prenatal. Question 40. Untreated severe neonatal jaundice leads to which category? The answer is B, perinatal/postnatal neurological damage. Question 41. Cognitive deficits following a head injury are which cause? The answer is C, postnatal. Question 42. The mother's substance abuse primarily affects the fetus during which period? The answer is A, prenatal period. Question 43. Which of the following is an environmental cause? The answer is B, lead toxicity. Question 44. Which is primarily affected by prolonged oxygen deprivation during delivery? The answer is B, brain tissue. Question 45. What is the correct example of multifactorial etiology? The answer is B, genetic plus environmental interaction. Question 46. At which stage is the risk highest for the fetus due to maternal rubella infection? The answer is A, prenatal. Question 47. Why does severe malnutrition damage cognitive development? The answer is A, brain maturation is affected. Question 48. When is genetic counseling essential? The answer is A, when hereditary syndromes are suspected. Question 49. Which of the following is a preventable postnatal factor? The answer is C, untreated central nervous system infection. Question 50. What is a correct example of the perinatal stage among ID causes? The answer is B, premature delivery complications. Question 51. Neurotoxic exposure primarily damages which system? The answer is B, developing nervous system. Question 52. Severe untreated seizures causing cognitive decline in children belong to which category? The answer is B, postnatal neurological factor. Question 53. Which of the following is a congenital genetic disorder? The answer is C, Fragile X syndrome. Question 54. Which is the most sensitive phase for fetal brain development? The answer is A, prenatal period. Question 55. What defect mostly results from perinatal complications? The answer is A, neurodevelopmental impairment. Question 56. Which is an example of secondary prevention? The answer is A, early screening and intervention. Question 57. What is the main purpose of the concept, early identification improves outcome? The answer is B, improving functioning through timely intervention. Question 58. What is primarily affected by maternal iodine deficiency? The answer is A, brain development. We continue with question 59. What is the most effective way to reduce intellectual disability caused by central nervous system infections? The answer is A, immunization and early treatment. Question 60. What is the most comprehensive perspective on ID causes? The answer is B, considering all biological, social, and environmental factors. Thank you for joining this video from Help Hub. For any questions, please contact us at helphub007@gmail.com or visit our YouTube channel at www.youtube.com/@helphub007.